So, what about return to sport times after meniscus repair? So, the majority of studies recommend return to sport somewhere between 3 and 6 months. And I have to tell you, at 3 months after meniscal repair, that's super fast, right? I don't feel comfortable doing that based on my experience, especially if you have a more conservative doctor. Let's say you start weight bearing as tolerated by the 6 week mark and you were restricting range of motion up until then. You only have 6 weeks to get someone completely ready to run, jump, change direction, do everything that's required with a given sport. I think 3 months is really, really fast, right? And I think the 6 months is probably a little bit more reasonable. But again, that's my personal opinion, right? This study by Logan et al. In 2009 gave us a little bit of feedback on when elite level athletes return back to sport after meniscal repair, right? So I had 45 repairs. These were in elite athletes, which the definition was professional or amateur that competed nationally or internationally. And the majority of these athletes were in rugby, but they also had netball, basketball, soccer, touch football, hockey, and some other sports, right? And they had a minimum of 5 years follow-up, which is pretty good. So they're going to check and see how they're doing years after this repair, as opposed to, let's say, 6 months to a year. They have more data. And the good thing is that 81% return to sports, and that's pretty dang good. The other thing that's important is that the vast majority return back at their prior sporting level. So a big issue with return to sports is that if you return back to sport, obviously that's good, but how often are you returning back to the same level? For a lot of athletes, if you're playing a professional sport, if you can't get back to the same level you were playing at previously, then you're really not that helpful for the organization, right? So you can argue that that surgery was not a success. But 81% of these athletes returned to sport, and the vast majority got back to their prior sporting level, which is a good thing, right? The mean return to sport was 5.6 months. And this ranged between 3 and 8 months for an isolated meniscal tear and 11.8 months for ACL reconstruction with meniscal repair. We'll talk a little bit more about this later, but suffice to say, if you get the ACL done with a meniscus, it tends to be a longer rehab time. And what I will say is that this 5.6 months makes me a little more comfortable as a clinician. That's what I tend to see. I see folks getting back closer to that 6+ month mark, right? And I think that's more realistic as opposed to 3 months. I think if you tell an athlete they can get back at 3 months, which I have certainly seen, oftentimes they're left very frustrated because they get back, they're hurting, they're not performing well, sometimes get re-injured, and that's obviously no bueno, right? So I think it's better to set the expectation that it might take closer to 6 months. If you're feeling phenomenal, maybe return a little bit sooner, but I don't want to push it, right? And give that athlete the idea they're going to be able to get back sooner, and then they get disappointed, right? This was also interesting because we're going to talk about this a little bit later, but age, size of the tear, and location of the tear were not associated with a higher failure rate, right? So we just made this big hubbub about if you have an individual, you have to treat them like an individual. But it doesn't seem like, at least in this study, it made a difference, right? So if you had a bigger tear, if you were older or younger, right? If you had a different location of the tear, medial versus lateral, anterior versus posterior, didn't seem to make a difference, at least with failure rates. And medial meniscal repairs were significantly more likely to fail than lateral meniscal repairs, with a failure rate of 36.4% and 5.6%, right? So take back what I just said, right? Because the medial versus lateral tear obviously was significant. So at least in my mind, I start to think, well, do we have to be a little bit more careful with the medial repairs just because they had a more likely or higher likelihood of having a re-tear over the course of time? So this image is taken from a paper from Kalana et al. In 2022. And what they're trying to do is give you a return to sport time that's going to be related to the degree of damage that you had from your meniscal tear and subsequent repair, right? So use this Tegner scale to quantify how bad the tear was. So if you had a stable tear, and that would be a longitudinal vertical tear, right? If you had a Tegner 0 to 3, you can return back in 2 months, Tegner 4 to 5, 3 months, Tegner 6 to 10, 5 to 6 months, right? And if you had an unstable tear, so this would be radial tears or root lesions, a Tegner 0 to 3 would be a return to sport at 3 months. A Tegner 4 to 5 would be return to sport at 6 months. And a Tegner 6 to 10 would be return to sport at 9 months, right? And I think this does make a little bit of sense, right? So if you have a really bad, unstable tear, then we probably have to go a bit slower. It takes a little longer for you to get back to sport, right? If you have a really small tear and it was repaired very easily, you're having a very good rehab, maybe we send these folks back to sport a little bit sooner, right? Keep in mind the paper I talked about previously actually showed that this wasn't as important as we might think. However, I do think this is probably reasonable. Big tears, unstable tears go slower. Small tears, very stable tears, longitudinal tears, and go a little faster.
So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.